This conference will now be recorded.
अद्य गुरुवासरः अथवा बृहस्पतिवासरः कार्तिक शुद्ध एकादशी भागवत एकादशी दिनांक 26 नोव्हेंबर 2020 सहस्रयोगम महामायूरघृतम् शंखं चक्रं जलौकान् दधतमृतघटं चारुदौर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यांशुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवनप्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम् ब्रह्मणो हि समारब्धा मात्रेयाद्येषु पूजिताम् अस्मदाचार्यपर्यन्तां वन्दे गुरुपरम्पराम् आयुर्वेदरतं वन्दे माधवाख्यं महागुरुम् आयुर्वेदामृतं सर्वं शिष्येभ्यो यः प्रदत्तवान् द्रष्टाज्ञानी दृष्टकर्मा कृतकर्मा तथैव च अध्यापकोऽभिषक्श्रेष्ठो महान् संशोधकस्तथा गुणैरेतैः समुदितैः यत्कार्यं प्रतनोति सः समृद्ध्यर्थं हि कार्यस्य वयं नु प्रयतामहे सरस्वत्यै नमो यस्याः प्रसादात् पुण्यकर्मभिः बुद्धिदर्पणसङ्क्रान्तं जगदध्यक्षमीक्षते आत्रेयं प्रथमं वन्दे आयुर्वेदशगद्गुरुम् आयुर्वेदामृतं सर्वं गृहीत्वा हि सुरेश्वरात् अग्निवेशादिकेभ्यो यत् प्रयच्छत् मुनि सप्तमः प्रथमं तन्त्रकर्तारम् अग्निवेशं नमाम्यहम्। महामायूरघृतम् एतेनैव कषायेण घृतप्रस्थं विपाच्य चतुर्गुणेन पयसा कल्कैरेभिश्च कार्षिकैः जीवन्ति त्रिफला मेधा मृद्वीकाद्विपरुषकैः समङ्गा च विकाभाङ्गी काश्मीरी कर्कटाभयैः आत्मगुप्ताः महामेधा तालखर्जूरमुस्तकैः मृणालबिसखर्जूरव्यष्टि मधुकजीवकैः शतावरी विदारीक्षु बृहति सारिवायुगैः दुर्वाश्वदंशारुषवत् शृङ्गाटककशेरुकैः रास्नास्थिरा तामलिकी सूक्ष्मेला शटिकौष्करैः पुनर्नवा तवाक्षीरी काकोली धनुयासकैः मधुकाक्षोणवाताम मुञ्जातादिषु कैरपि मुञ्जातादिषु कैरपि That might be the theme. तो वही कषाय है, the same कषाय भूतप्रस्थ, और these are the kalka चतुर्गुणेन पयसा कल्के रेभिश्च कार्षिकै. So 4 times milk and karshika 1 karsha of this kalka jivanti trifala vedam rutvika etc. So that quite big part as such. महामयूरमित्येतत् मयूराद् अधिकं गुणैः धात्वीन्द्रियस्वरभ्रंश श्वासकासाद्वितापः योऽन्यसृक्शुक्रदोषेषु शस्तं वन्ध्या सुतप्रदम् आकुभिः कुक्कुटैः हंसैः शशैश्चेति प्रकल्पः. So this is Mahamayura and this is Mayurad Adhikan Gunai. It is even more beneficial than Mayura Ghritam. Dhatu Indriya Swara Bhransha Shwasa Kasa Ardita. Indriya Swara Bhransha Shwasa Kasa Ardita Yonyasrukshukra Dosheshu. So this is quite interesting. Asruk dosha, Ardava dosha and Shukra dosha and Yoni dosha. Shastam Vandhya Sutapradam and is Vandhya Sutaprada. Akuve Kukutehi Hamsehi Shashaish Cheti Prakalpe. The same may be prepared with rat, Kukuta, Hamsa and Shasha. So now Mayura is out of question because it is totally banned. Only in the remote Adivasi areas they might be eating it or something. But common is Shasha and Kukuta to a certain extent. Only thing is Kukuta is Vana Kukuta is a better choice. And if it is possible to make Maha Ghritam with one kukkuta, that will be great. जीवंती त्रिफला मेधा मृत्विका द्विपुरुष परुषक समंगा चविका भारंगी काश्मरी कर्कट कर्कटाभ कर्कटशृंगी आत्मगुप्ता महामेधा ताल खरजूर यष्टि मधु जीवक शतावरी विदारी इक्षु बृहति सारिवा दुर्वास स्वदंष्ट्रा षठी पौष्कर पुनर्नवा तवाक्षरी काकोली धन्वयास मधुक अक्षोळ वाताम मुंजात कल्क गोघृत मयूर मांसरसर दशमूल बलामूल रास्ता यष्टिमधु त्रिफला कषाय क्षीर क्षुपोर प्रस्थ is superior to Mayura Ghritam. धातुक्षय इंद्रिय नाश स्वर भ्रंश श्वास कास अर्दित योनि दोष रक्त दोष शुक्र दोष वध्यत्व. So Falashruti is quite wide. Particularly this Mayura Ghritam is useful in Urdhva Vikara. So I had tried to use it in brain cancers, Nasya particularly, and even Abhyantara. But as this is very difficult to get, one kukkuta one may try, and that should be fine. Or we may get it prepared elsewhere in Western countries and then bring that ghritam. that is also fine. Even Maha Mayura Ghritam or something. Only thing is all these medicines will have to be carried over there. So Maha Kukkuta, Vana Kukkuta is a better choice. Ardrakardikratam. आर्द्रक व्याधि घातार्क स्नुहित्रायंतिका रसे व्योषत्रिजातांकां त्रिजातकांपोद धात्री कुंभ विलंगकैः कल्पितैः साधितं सर्पिः उदरामय नाशनम् पीतमन्येन वा अन्येन युक्तं वा प्रातः समुपयोजितम् अन्येन त्रिकटु त्रिजात अंभोद मुस्ता धात्री अमलकी कुंभ त्रिवृत विडंग कल्क गोभृत आर्द्रक व्याधि घातक आरगवद अर्कस्मुहि त्रायंतिका स्पर्श. This should be virechana. And early morning with suitable anupana. Udara roga. So here udara might be just udara roga. जी बाल के लवकर बोलत नाही तर ट्राय करता येईल का? Yes, it is possible to try in these. Generally, if we prepare odana and with that hot odana, brahmi grita, Vagmedha Kurta Kurta, etc., to be kept on people leaves above and below and allow it to cool down little bit, not very much, but one should be able to eat it and then give it to the balaka. This generally works. This is to be performed every Sunday. And another is this Navi Prakshepa of Vachataila, that also helps. But maybe we try this. that is also fine. Gopyadi Ghritam. नन्नारी कृष्ण सारिवा उत्पल कंद मधुक चंदन कुष्ठ वट अश्वत्थ प्लक्ष उदुम्बर शृंग उशीर गोघृत दुर्वास्वर स मिल्क नन्नारी धारा एंड लेप मर्मस्थान व्रण तीक्ष्ण उष्ण गुरु व्रण एंड प्रमेह व्रण. Is this available Nannari Ghritam? Does anybody know? The part is rather simple. We can prepare it. Krishna Sariva Utpalakanda Madhuka Chandana Pushta Shrunga Vata Ashwatha Plaksha Udumbara Shrunga and Ushira. More Shita Dravyas are there. Bhavana is also, or the Dravadravya is also Durvasvarasa and milk. Gogruta one part. But all sorts of Vrana, including that of Prameha and Marmasthana Vrana, this is very typical. Dhara and Lepa. I have come across wounds of cancer, particularly breast cancer and oral cancer. These are very troublesome. And unless and until we are able to conquer cancer, it is not possible to get any result in these wounds. Many times they are infected, they are having very foul smell and severe pain. So in oral cancer, this is common, but this is also found in breast cancer particularly. And very, very difficult to manage as such. So I think we should prepare it. Not very difficult. And second is the Hansen's wounds. These are also again typical. So I have come across a few cases of Hansen's wounds, and they have been dealt with properly. We have better results in Hansen wounds than allopathy. And even in gangrene, this might be used. This is Rakta Prasadana more. So I think this should be a better thing. Panal Patiryadi Dhrita Alarka Vishahara. Kamala Bija Tikatu Vacha Lashuna Yashti Hingu Dvijiraka Ashwagandha शीतल चिन्नी द्राक्षा चंदन त्रिफला आरक्वद पनल पटल कार्पास समूल पाठा मुंजा करलेख श्रीश पंचांग मधुक बिल्वमूल वसुख नीली त्रिफला सर्पगंधा उशीर कषाय व्याघ्रपदी अपामार्ग नयावल्ली ब्राह्मी बिंबीपत्र दशपुष्प विष्णुक्रांता दूर्वा. I've never seen flowers of durva. भृंगराज शक्रलता वाराही भद्रिका उत्तम कन्यका सहदेवी सासकर्णी शशकर्णी लक्ष्मणा समंगा लज्जादुस्वरस. Alarkavisha Lomadivisha. Is this available and administered internally after Shodhana therapy? Panal Patiryadi Ghritam. गवत फूल असेल का दुर्वा फ्लावर म्हणजे गवत फूल durva is durva. Truna is any kind of grass. You can't say. But if this is useful, even in mad dog bite, then that's a great thing. Whether this is in practice in Tamil Nadu or Kerala, that we have to see. If it is in practice, then this should be good. Panala Patiryadi Ghritam. Just look whether this is available. Ajamausa Ghritam. Dronepam sadhayad rasna dashamula shatavari. Palonmitad vikudamam. Dattam badaram yamam. Zulardam chajamausasya tena sardam vitadakam. Samakshiram palamshaischa praviniyas samikshatat. प्रयुक्तं वातरोगेषु पाननामन वस्तुभिः पञ्चकासान् शिरःकम्पं योनिवेक्षणवेदनाः सर्वाङ्गैकाङ्गरोगांश्च लीहोर्ध्वानिलाञ्जय सप्लीहोर्ध्वानिलाञ्जय. Ajamausa rasayana is available. Monkey bite pun. Yeah, it would be. Monkey bite is very rare. I don't know where I have come across. But dog bite is very common. And this anti-rabies, if it is available, then it's okay. Sometimes it is not available. Sometimes the patient comes to us very late when there is hydrophobia already developed. And then conventional medicine has no treatment to be offered. They are just isolated and allowed to die. That's all. In Naidu Hospital, there is a separate wing for this, only for dog bite people. And it's very miserable to see them dying without any treatment. So they can't see water, no matter of drinking it, and then they are starved and die. That's all. So dehydrated and then die. So if at all there is a chance to save them, then this is fine. I have one variety of ikshu which is said to be useful for this, the juice of that ikshu. So that might be of help. And pankanis that I heard to be used along with Guda for this Shwanadausha, hydrophobia. So these are again great things kept in dark room. Yeah, that is true. So they are very afraid. There are symptoms of this ojakshaya. I am not sure whether somebody has tried milk in place of water, whether they can tolerate milk. Because there are symptoms of ojakshaya. I have hardly seen one or two patients that too from a distance, and they allow nothing to be done. So it was Vaidya Bhavdekar's cousin brother, just 18, 19 years old, and he died with this. That story. But may have to think about this if anything can be done. So this Panal Patiryadi, if it is available, let us try it. Alarkavisha, Lomadivisha. Lomadivisha, I don't know. We have this Survanta, which is having loma and it has a toxic effect. So might be useful in that. It contains Shrivisha Panchanga. So that is also one of the important. And Ajamausa Grutta, Ajamausa Rasayana and Ajamausa Grutta are the same or different? So Shirakampam, this is one of the important symptoms given in Ajamausa Ghritam. Yonivankshana Vedanaha. This also we may try to use, particularly in Kashtartha. I'm just not remembering the name right now. Vimaragagamana. Very common condition now. So in that we may try to use it. And Shirakampa endometriosis, yeah. And Shirakampa in Parkinsonisms we may try to use this. And is Ajamausa Rasayana and Ajamausa Vrutta same? Does anybody know? So Dashamula Shatavari, Kulatha Badara Yava and Ajamausa. Samakshira. And Junior. So this should be not very difficult to prepare also. Panabastyanasya. Panchakasa Shirakampa Yoni Vedana Vankshana Vedana Sarvanga Roga Ekanga Roga Pliha and Urdhvata. So I think this is a better choice to use. So next is Mrudvikadighritam. Mrudvikagoksharananta punarnavashute jale Mashaila Jirake Pakvam Kritam Shukrasya Vardhanam. Very simple part. And not a very well-known Shukravartak Dravya. Gokshura is there and Masha is there. Masha Ela Jiraka Kalka Gokbhuta and Mrudvika Gokshara Ananta Punarnava Kashaya. Shukravardhaka. And only Falashruti is Shukravardhaka. So Murdvika Adhikurta, is this available? This we can prepare definitely. The role of Jiraka Punarnava to be understood. So this is fine. So I think table of weights and measures. Rati Guncha 125 milligram. 8 Rati is 1 gram. Is equal to Masha, 1 Masha. 4 Masha is Kalanchu, 1 Kalanchu, 4 gram. 12 Masha is 1 Karsha Tola. 1 Karsha is equal to 1 Nishka, 12 gram. 2 Karsha is Shukti, 2 Shukti is Pala, 2 Pala is Prasruti, 2 Prasruti is 1 Kudava. This is Prastha, 96 gram. 2 Kudava is 1 Manaka, 2 Manika is 1 Prastha. 1 Prastha, I was understanding 640. Here it is 3 kg. 4, no. 768. So why there is a difference? शुक्रवर्धन इंडिकेशन असलेले औषध स्त्रियांमध्ये देताना कसे विचार करा? This is a big question. I have spoken about this long back, and Shukra as a dhatu is common in male and female, which is responsible for regeneration of other dhatus. But Stri Shukra is Artava and Purusha Shukra is Shukra, as what we found, and Artava is Agneya. So when we are talking about Stri Bija, then it is Artava, and these Shukravardhaka yogas may not be useful for them. For them, those which are rectifying Artava or which are Vandyatva Nivarana, etc., those to be used. And as Dhatu, in all gents and ladies, this might be of help, Shukravardhaka as such. But truly speaking, it is generally used for these three Purusha Bija, Shukra, and not in general Shukra Dhatu as such. So whether Vajikarana Dravyat should be given to ladies or not, this is again a big question. Now, Apatya Santana Karatva and Satya Samprahasha, these are two what you can objectives. So Apatya Santanakara is associated with Stri Bija or Purusha Bija. These are specific, but Sadhya Saprashana, that might be common for ladies and gents. So those yogas in which it is used for Sadhya Samprahashana, those can be used for male and female both. And only Apatya Santana Janana is different for male and different for female. So those which are Vandhya Sudaprada, etc., those are to be used in female, and those which are for Nashta Shukra, etc., are to be male, are used in male. So this still remains a question, what is to be used where, and how to differentiate between these two kinds of yoga. But what I feel right now, स्वस्योर्जस्करं यत्तु तद्वृक्षं तद् रसायनं प्रायः प्रायेण रोगाणां द्वितीयं प्रशमेन तं प्रायः शब्दो विशेषार्थो विभयं विभयात्. So one which is increasing the urja of a swastha is rasayana and vajikarana both. So vajikarana can be used for increasing the urja of the swastha in general. That is one thing. And that can be used for treating diseases as well, particularly caused by Shukrakshaya. Now, Shukrakshaya can be understood both with infertility and impotency or something like that. But Artavakshaya or Stri Bija, formation of Stri Bija, difficulty in formation of Stri Bija has to be dealt with separately. And the impotency in ladies have to be dealt with separately. That is what my opinion about this. So we may have to think about this on practical level, and the hormones or the stress, depression, anxiety, worry, etc., does have an impact on hormones, and they are creating dhatu kshaya, oja kshaya, etc. To counteract this, along with the Roganashana medicine, we may have to use Rasayana and Vajikarana Dravyas, even Vajikarana. Rasayana Dravyas we try to use, but Vajikarana Dravyas also have to be used. Because Manaso Harshani Yancha Tat Sarvam Vrishya Muchyate, whatever is pleasing the mind is Vrishya. On the other hand, whatever is depressing, whatever is creating Vishada, etc., is Avrishya. So there is no desire for sex or when one person is stressed, in anxiety, fear, etc., etc. So one can overcome these conditions with Vajikarana medicines and increasing the ojas and such. So these are effects of the dravya over psychological aspects, and those have to be particularly used in all these conditions. I really wonder that Charkacharya has put Rasayana and Vajikarana as first adhyayas of Chikitsa. In Nidana Sthana, he deals with Jvara Nidana and all other 7 diseases or total 8 diseases. And while beginning the Chikitsa Sthana, unlike the other followers who have prescribed Rasayana and Vajikarana at different places after main Chikitsa or something like that. Vagbhata has put it to Uttarasthana, Sushrutaracharya has put it in Sutrasthana. So, this is rather strange. The Charkacharya starts with Rasayana Vajikarana. So, why? Though Apatya Santanakara and Sadhyasam Praharshana, this is the Falashruti of Vajikarana, and Lagopayo Shastanam Rasadinam Rasayatanam Rasayan. This is the Falashruti of Rasayana treatment. Even beginning of any other treatment of any other disease, he explains about Rasayana and Vajikarana. So this emphasizes the importance of these in treating diseases, and this fact has been neglected. So there was a debate on this Purva Rupa and Rupa, and how to deal with patients without any symptom. That's a major issue. Hepatitis B positive, HIV positive, high blood pressure without any symptom, hyperglycemia without any symptom, etc., etc. In that scenario, if according to us the disease is a product of dosha and dusha, then panchakarma treatment to take care of doshas and prasayana treatment to take care of the dhatus or strengthening the dhatus is one of the way. If it is possible to give rasayana and vajikarana to a patient with depression, anxiety, neurosis to help them come out of it. Yes, that is what I am saying. We should be doing it. We should be increasing ojas, which gives pushti and bala. How can we think of Shukra Dhatu aspect in menopause management? This is still a different issue, and we don't have any mention about menopausal syndrome as such, which is commonly seen nowadays. Hot flushes, depressions, mood swings, etc. These are very common in menopause today. So I think there are social reforms and that are leading to this menopausal syndrome today. It's not only the menopause. In old days, there were big families, not nuclear families like this. There used to be many deliveries, 8, 9, 10 deliveries or something like that. And the house would be full with many people. And the ladies were concentrating only on homely working or home working or something like that. And there was a lot of support in the family because there were so many people or something like that. And then menopause was easier. There were no symptoms of menopause. There were no symptoms of loneliness. Now what happens? There are hardly one or two children, nuclear families, and if she is a housewife, not engaged in some career or something like that, then when the children are grown up and they have their own career and future, etc., etc., there is a vacuum created in the minds of the household ladies. Husband is engaged in his work, children are engaged in their own field, and there is nobody to share something like that in the house. And this is causing more problem. That is what I feel. आधी मेन्स्ट्रुअल काळात आराम मिळत होता स्त्रियांना, आता सतत काम करतात, त्याचा काही संबंध पण असेल का? This might be there. But basically, the social reforms that have changed is one of the important causes. And this particular phase is observed during when the children are grown up, they are not still married. When they get married, again further responsibilities start. There would be a bride coming to the house and daughter-in-law, and then further generation. So grandsons, granddaughters, etc. And they start spending time in that, getting engaged in that. But this particular phase, this is very typical or something like that. And then this is a difficult thing. According to Datar Shastri, in menopause, the Prithvi Mahabhuta decreases, so the imbalance causes Agni, Vayu, and Akash Mahabhuta to increase. Then we have to treat accordingly. Now, even conventional medicines say that there is osteoporosis, etc. Now, there is another reason of this vitamin D3 deficiency, and then arthritis, etc. Other problems evolve. But basically, this I feel is associated with psychological factors more. And secondly, the preparation of food or cooking was in sitting postures previously. Now with this kitchen ota, this is has totally changed, and we do cooking while standing or something like that. So that is also one of the causes and to be considered. And more importantly, as I say, is the psychological aspect. And now the average age of marriage for ladies or girls is 24, 25 onwards, and those of males is 28 onwards or something like this is the scenario. By the time they conceive, the girl is around 25, 26, the male is around 30 plus. And from this phase, from this year, when the girls become aged or reaches menopause, so 25 years or so from this phase, their girls and sons are not married at this time of menopause. Previously, by 50, the son and daughter would get married. Now it is 60, 10 years ahead. And then this phase of menopause is in between this. And in 60s, they may have grandsons and granddaughters, and they don't have that physical capacity at that time. And if it is even more late due to PCOD and other things, then you're 65 plus when you have granddaughters and grandsons, etc. And then this is very difficult to manage grandsons and granddaughters. No doubt there is a pleasure, but still physically one is not coping with that. So we need to go back to the social reforms, really speaking. And the education, which used to end by 18, this has gone much ahead. And what kind of education are we having, and is it really useful in practical life or not? This is again a big question. So, truly speaking, if we start education at 5, 6, or something like that, now the early schooling is also there, and many educationalists are saying that this is wrong. This should not start before fifth year or sixth year or something like that. And maximum by 20 to 22, 23 for male, this should finish. It used to finish at 18 previously. The maturity onset of a male is 20 to 25, and those of female is from 20 to 16. So, if women are fully mature by age of 16, now according to law, 18 is the year for marriage or something like that. So let us consider it 18. And the male at the age of 23, 24, 25 as per maturity or something like that. And both are settled, so to say. Unfortunately, even for males, this age is not sufficient to have finished the education and have started earning and such. And girls are also engaged in career now. They also don't want to marry earlier. And then there is a big impact of this on society in general. And this has led to many things. Who is going to look after the children? That's a major issue. So development of children is also a very big task. And one can't say that this is subordinate work. This is equally important work as earning money. So these are two wheels of a car, male and female, and there should be some harmony within that. That harmony is lost, and everybody is running after money. So the pleasure of life is gone. In old days, even with meager earnings, people were happy and satisfied. Now, with lot of money, people are more worried, more dissatisfied, and having low energy, varieties of diseases, etc. So there are so many reasons behind this. And actually, the social sciences should bring this mm, to the front line. These issues. Now, these are all linked together. We bifurcate sciences from social sciences, as if we don't have to do anything with social science. When I was in TMV, there was the social science department was strong, and this was external education. Those who could not do their proper education used to turn towards social sciences to get some degree. I read few topics from the social sciences books and found them to be very effective. But we have Nagrik Shastra in our school days. And how far we are serious about that? Even I was not very serious about that. That was just one subject, and one has to get through. Not very difficult to understand and not very difficult to answer. But the importance of all these is really not understood. The whole purpose of education is lost. We are just preparing clerks as what British wanted us to be. And even literature and drawing, painting, and many other fine arts do carry much more importance in our life. Everybody will not be happy only with science education and becoming engineer and other things, etc., etc. And as such, the prestige and pride should not be linked with earning of money. That is yet another important aspect. One who is earning well by any means, unethical ways also, is having pratishtha in the society. They have described one case treated by Data Shastri, a lady of menopause having knee joint pain who has been treated with regular Ayurvedic medicines but not got relief. Referred to Data Shastri, sir gave her Girish 6 times in a day for 1 month and the patient got relief 60 to 70%. He described it as due to Prithvi Mahabhuta decrease, the Tejri Mahabhuta increase in that patient. Yeah, this is quite possible, and this is hot flushes. This is one of the important symptoms. I remember one case from Konatkar sir in which it was apparently Sandhigata Vata and he used Girija and that relieved her. And when I asked why did he use Girija, then he said it was Sandhipida due to Ati Aushnya. And Atisvedana has the Sandhipida Dvarshavarta Mandala Darshanam. Svedati Yogachardishta Tatrastambhanam Aushadam. She was being treated by Svedana, and that was not relieving her actually. Tatrastambhanam Aushadam. For Stambhana, he gave Girija, stop Svedana. And then that patient got relieved. So, what I feel, one should look into the Shastras properly, properly understand, and then use it properly. That will be more important. So what I feel right now is the social reforms that are taking place are also contributing to today's diseases, today's syndromes, etc., etc. And nobody is paying attention to them. Allopathy is just looking for symptomatic relief, that's all, nothing more than that. We as Ayurvedic people would like to see the dietary pattern, lifestyle, etc., etc., but these social aspects are even neglected by us as well. And we need to change social reforms, may write books on that, etc., may try to propagate. I have one audio series in my mind, 63 or 36. That is the title. 36 का 63 का 36. So the main concept is human relationships. Whether we want to become 63 or we are becoming 36. And if there is no dialogue between any two, maybe father and son and daughter, mother, son and daughter, father and mother, daughters and brothers, etc., etc., or in-laws and many, many. There are so many relationships, even teacher-student relationship, etc., etc. So explore all kinds of relationships in which there can be 36 approach or there can be 63 approach. And Atyantika Rakta Shobha or something like that. So these relationships do matter, and one may have very good results when there is improvement in these relationships. And there are so many TV serials now. And regarding this relationship and the daughter-in-law and mother-in-law, these relationships are more commonly focused. But there are other relationships as well. And this has to deal with varieties of ailments, psychological ailments reflecting on body. So what I feel right now is we need to emphasize on these aspects as well. And these are being neglected. So like this hormonal imbalances, this is one of the important reasons for hormonal imbalance. And now this lockdown has produced some good effects. That is, the attachment or the bonding of family members has become strong during this lockdown period because everybody else was at home. So this was one of the good effects of lockdown. So let us take a lesson from this and continue with that, this family bonding. Why there are suicides? Why there are depressions? Because there is nobody to help. That is what the person feels. There is nobody to share. That is what the person feels. And then he gets into depression, and that may lead to a suicide tendency or something like that. So, man is a social animal. That is what they say in social sciences. And we are a part and parcel of the society, and we need to emphasize more on these psychological aspects as well. So myself and Sohan Pathak or Yashasvi Joshi may get into this to publish a book. Maybe I use this same audio audio media to explore these kinds of relationships. And what are the pros and cons associated with this, and how do they reflect on their routine life and in maintenance of health or even for facing diseases. So what I feel, this is a big topic as such, and may have to deal with it more effectively. So this is Mana Paribhasha. Therapeutic index. Ama Pachana. Pachana Kashaya Amrutadi Kashaya. Pachanamrita. Agni Deepaka. Deepaniya Peya. Patha Karanjadi Grita. Agni Kumara Rasa. Aruchi. Shleshmajvara Kashaya. Swarabheda Hara Kashaya. Aruchihara Amla Kashaya. Vatahara Kashaya. Panchatikta Gugulu Grita. Dashanga Grita. Tugadik Churna. So I think let us make an index of this and keep handy. It's very difficult to know those yogas, go and see those yogas all the times. But with app, it is possible now that we find a particular thing, particular symptom, particular disease as such. Now these are all symptoms, so to say. There are Vatajvara, Pittajvara, Vibandha. It is not alphabetically indexed. From Aruchi, it has directly gone into Vibandha. But this is in English, so we get a photocopy of that and run OCR in English. So we will be able to edit it and then alphabetically arrange the conditions. That should be fine. So this is good appendix anyway. Vatajvara, Pittajvara. किती वाजले रे? झालेच मला वाटतं ना. संधिपातज्वर, कफज्वर, नवज्वर, शीतज्वर. ओके. उपद्रवयुक्त ज्वर, विषमज्वर, अभिन्यासज्वर, जीर्णज्वर, सततज्वर, संततज्वर, निम्नोन्नतज्वर. So there are varieties. अतिसार, प्रवाहिका, विषुचिका, कृमि, कामला, राजयक्ष्मा, वाग्रह, छर्दी, हृदरोग, प्रमेह, नाड़ीव्रण, भगंदर, श्वित्रकंडु, कपाल रोग, मुख रोग, उपीनास, मेदहर रोग, मेधार रोग, फिरंग रोग, अभयादि मोदक, अभयारिष्ट. So this is alphabetically indexed. So that is fine. Adhaki, drugs of sahasrayoga. This is also good. Agadha, दद्रुमाद्रि औषधि विशेष अर्कराग रतन ज्योति भुषारकर. So what I feel is very well managed book. Comparison of number of formulations mentioned in CCRS publication and in the respect text. So 575 here in the present text 265. Taila 124.91. Ghrita 153.86. लेह प्रकरणम शतावरी गुण. Okay. So I will try to get Madhavanidan Madhukostika on the net, and if it becomes available tomorrow. This Sahasrayoga book is of which author? Maybe we have to see the first page, and there would be other as well, and whether they have these appendices or not, that we have to see. So I may have a concluding remark on Sahasrayogam, etc. My main objective in reading this and how far we have been successful in achieving that objective, and what can be done further about this book that we may think of. And these particular appendices are very good, there is no doubt. So if anybody from you is ready to take up this task, to take a picture, run OCR and convert into Excel sheet. Is anybody ready to do this job? Nobody is interested. पण तुला ते फोटो काढून देईल सुशित, समजा पुढे ते सगळं म्हणजे सुशित वरतीच येईल जास्त. So let us see if this becomes available in Excel sheet. Okay, so let us try about that. And if I get the version of Madhavanidan Madhukostika, then we may start with that after concluding this. R. Vaidyanath and K. Niteshwar, published by Chaukhamba Krishnadas Academy. Vidyanath. No, that is fine, but I am ready. But don't get what you want to what in Excel sheet didn't get. You may call me. So you have to take a picture of this. That will be a JPEG file, and then you have to run OCR on that. OCR in English is easy, and then that gets converted into Word, Microsoft Word, and then you have to pick it up and paste it in Excel sheet, and then we can arrange it alphabetically. That should be fine. So you may call me, and I can guide you, or Sushrudivan can also guide you. I am working on it, but only on available kalpas of Sahasrayogam, that is of Vaidya Ratnam, done with Asavarishtam. So please share that. We'll share with you what I have done. Yes, that's fine. So that is yet another important aspect that which are available. But those formulations which are easy to prepare, we may think of them. I am also interested in working on it. So if you are conversant with this technique of photocopying and then convert it into a Word document first and then picking up in Excel sheet, that should be fine. You may also contact me. That is fine. So let us conclude today and continue tomorrow. आयुर्वेद प्रकाण्डो निगदित इह हि शल्यतन्त्रप्रधानः शिष्येभ्यः शाश्वतोऽयं निखिलजनकृपा व्याप्तचित्तेन येन आयुर्वेदस्य वाञ्छन् पुनरपि भुवने तां च सुष्ठु प्रतिष्ठां श्रेष्ठं धन्वन्तरिं तं प्रणमति च सदा वैद्यवर्गो हि नूनम् वैद्यवर्गो हि नूनम् विरम्यते व्याख्यानव्यापारः श्वः पुनरपि मिलिष्यामः।